syringe sales in community pharmacies for prevention of bloodborne pathogens among persons who inject drugs. So we know that persons who inject drugs, or PWID, can substantially reduce their risk of getting and transmitting HIV, viral hepatitis, and other bloodborne infections by using a sterile needle and syringe for every injection. In many jurisdictions, PWID can access sterile needles and syringes through pharmacies without a prescription. The graphic on the right comes from the CDC HIV Prevention Progress Report just published last week. And one of the indicators there is to reduce non-sterile injection among persons who inject drugs. And this graphic shows that in 2015, about 61% of PWID had not met that criteria. And the annual target for this is to get that down to 45.5%. Number of people who do non-sterile injections, so we're trying to decrease that. And these data come from the National HIV Behavioral Surveillance System at CDC. To give you a magnitude of the volume of prescriptions, non-prescription syringe sales that there can be, there was a 2015 survey of nearly 80% of the more than 1,000 community pharmacies in Massachusetts, where there's no limit on the number of syringes that can be sold. And they found that 97% of community pharmacies reported selling non-prescription syringes. Now in that survey, they didn't ask them what they were selling them for. They could have been non-prescription for diabetics or for PWID. But the point I want to make is the median sales per store was about 75 per week, which translates into nearly 100,000 non-prescription syringes sold statewide per week. So from where did PWID obtain sterile syringes? So we used the National HIV Behavioral Survey 2015 cycle of PWID in 20 US cities. This was published last year in the International Journal of Drug Policy. Among many questions that people were asked in that survey, participants were asked where they got their new sterile syringes, and the options were pharmacies, syringe service programs, and then there were other options as well. They were also asked about a number of behaviors, and particularly behaviors in the past 12 months, and the ones that we looked at were safe injection practices, safe disposal, and tested for HIV. And this slide is table 1 from that paper, and when we look at where people get syringes, there were about 10,000 people surveyed in the NHPS cycle 2015, which is the usual amount. And what we found was that 52% of participants ever used a pharmacy to obtain sterile syringes. And then importantly, when we looked at what was the primary source of the syringes, which is to the right of the slide there, about 25% primarily use pharmacies as their source of syringes, and about 36% primarily use SSPs as their source of syringes. And the next analysis is the comparison of these two groups. So we looked at participants who use pharmacies versus SSPs as their primary source of sterile syringes. What we found were that clients who obtained syringes primarily from pharmacies versus SSPs were less likely to have always used sterile syringes, were less likely to have been tested for HIV, or to have participated in an HIV behavioral intervention. And they were also more likely to have receptively shared syringes or disposed of syringes unsafely. So again, that's comparing people who primarily got syringes from pharmacies versus SSPs. What that points to is the need for training and support for the pharmacist to enable them to provide better services to clients. There are some pharmacy-based syringe access programs in the United States. What these typically do is they provide a framework for non-prescription syringe sales. They can provide specific guidance for HIV prevention counseling. They provide pharmacists and pharmacy staff education, syringe disposal referrals. And there's 3 statewide programs that I'm aware of, Minnesota, New York, and California, although other states have some activities. And some states also have safe disposal programs in which pharmacies can participate. So this is just from the Minnesota website. This is what you click on the document, this is what you get. This started in 1998. Some of the key provisions of the legislation are that pharmacies may voluntarily participate with the initiative, so they don't have to do this. But they may sell up to 10 syringes and needles at a time without a prescription, and that an individual can legally possess up to 10 unused syringes at a time. So it takes the burden off the client if they're found with the syringes. New York State has they call it the ESAP program, and it originally started in 2000 and became permanent, I guess, in 2009. And there also licensed pharmacies can furnish up to 10 hypodermic needles or syringes to persons 18 years of age or older. And importantly, again, persons who are age 18 years or older can legally obtain and possess hypodermic needles and syringes through ESAP without a medical prescription. And then in California, they started a pilot program in 2005, later expanded, I think, in 2010 or 11. And by 2015, the legislation was changed so that to where there was no longer any limit on the number of needles and syringes that can be sold to a customer. So originally it was 10, and it was 30, and they just took the limit off, and as many, they could sell as many as the client wanted. And they also provide options for safe disposal of needles and syringes by choosing one of the following options. So the pharmacist can either sell a furnished sharp container or a mailback sharp container, or they can provide on-site sharps collection and disposal. Now, there are barriers to pharmacy-based syringe access, and there's a lot of publications. I got stacked like this thick on my desk of all the surveys and research studies done on this topic. This is one example. Back in 2013 in California, in two counties. In this survey, they did these secret shoppers, and 22 or 21% of purchase attempts at 248 community pharmacies were successful. And the common reasons for failed purchase attempt were not having a prescription, not having the right syringe size, being told the pharmacy did not sell syringes, et cetera. And what the authors concluded, one of the things that the authors concluded is that in states where non-prescription syringe sales is legal but voluntary, the legislative changes alone may not be enough to substantially expand syringe for IDU. Now, like I said, there are numerous publications describing a willingness, reluctance, or uncertainty of pharmacists' attitudes towards non-prescription syringe sales for PWID. There have been surveys of pharmacists, focus groups of pharmacists, secret shoppers, and we need to stop studying pharmacists and start just including them as part of the prevention team. But the themes include things that you would expect in contemporary America. There are personal beliefs either that support syringe sales or don't support syringe sales. There might be company policies that enable it. There might be concern they might have concern for the public health to enable them to sell syringes. There's concern about the effect on other clientele in the store, syringe waste near the store, and then drug use near the store. And this is just one more snapshot from a paper that came out last year in the Harm Reduction Journal, and this was a survey assessment of Kentucky community pharmacists. And there's two of the questions here. How willing are you to dispose of used syringes and needles from injection drug users upon request? And about 20% were willing, 20% were in the middle, and then about 60% were not willing to do that. And they asked, how willing are you to provide clean syringes and needles? About 30% were willing, 30% were in the middle, and 40% were unwilling. So what this shows me is that people are all over the place with this. And so one pharmacist might feel very strongly one way, and another may feel very strongly another way. So I don't have a solution for you guys today, but what I wanted to just to encourage you to do from your health department standpoint is to engage your pharmacists and your community as partners in prevention of bloodborne pathogens. So I think it's important. I've heard this phrase, this is like the 4th or 5th time I've heard it this week. Meet them where they are. Right? They've been saying that all week. I've heard people say that all week. Meet them where they are, and then mutually manage expectations of what can be accomplished. So we want to go in and see what their feelings are with it. It's important to realize that non-prescription syringe sales may be are often left to the discretion of the pharmacist on duty, and they may or may not be dictated by an enabling corporate policy to support syringe sales. So they might have guidance that we should do this, or they might not have any guidance. It's just left up to that person. So the pharmacist today might sell the syringes, and the pharmacist tomorrow might not, and they're both just practicing their judgment. So education and tools are needed to support pharmacists in the delivery of harm reduction services to lower risk behaviors and facilitate safe disposal of syringes. And ideally, they would transition a syringe customer into a medically assisted treatment customer. How's that? So one of the ways to think about it when you start engaging with the pharmacist might be willing to sell 10 prescriptions to a PWID today, and I consider that clinical prevention. So sure, I'll sell syringes. I'm going to help this guy out. Hopefully he won't protect him from getting HIV or from spreading HIV or hepatitis C. And that's clinical prevention at that point of sale. They also, the next step was they'd have a store practice to always sell syringes to PWID when asked. Again, it's clinical prevention. But when you get into the realm of like public health pharmacy intervention, if there's a multi-store policy with training and SOPs that support pharmacists to sell syringes, so they actually have some guidance of what should I do when somebody comes in, with referrals to local substance abuse treatment centers, et cetera. And then the end of the strongest part of that would be if they were working with their state or local health department to implement a jurisdiction-wide policy that provides the pharmacists with guidance, training, education, and then referral lists for treatment, and a program for safe disposal of syringes. Because I think, like many people, pharmacists would want to be part of the solution and not feel like they're being part of the problem in this environment. So I'll just conclude by saying that persons who inject drugs get syringes from a variety of sources, including from pharmacies. And legislation may create an enabling environment for non-prescription syringe sales, but pharmacists' willingness to participate may require addressing other structural and professional issues. And again, engage pharmacists in your community as partners in prevention. And with that, I'll